And now Nigeria joined the rest of the world to commemorate the 2022 Universal Health Coverage Day yesterday, as the federal government of Nigeria promised to continue strengthening the health system, withstand epidemics, pandemics, and other health crises. The Minister of Health reiterated the government's commitment to reduce the proportion of persons incurring out-of-pocket health expenses to attain universal health coverage. Benedict Uko has more.
According to reports from the National Health Accounts, household out-of-pocket expenditure rose from 71.5% in 2019 to 72.8% in 2020, which is above the 40% target. The federal government said it is working to reduce this huge number to make healthcare accessible to everyone without impoverishing citizens. At the ministerial briefing today in Abuja, the Permanent Secretary, Federal Ministry of Health, said this will be achieved through engagement with the private sector to maximize the potential of a digital transformation in healthcare systems and enrollment into health insurance schemes.
In the year of the pandemic, we all saw that technology and digital transformations become the norm. They brought service closer and faster to those in need. The Ministry of Health, in recognition of the strength of Nigeria's digital ecosystem, has increased its engagement with the private sector to maximize the potential of a digital transformation in the healthcare as the future of service delivery. Citizens have the responsibility to hold us accountable and demand better services from the health facilities owned by the local government, by the state, and by the federal government. Citizens should insist on better health investment from those who govern them at all levels. The private sector should also partner with government more than they are doing now. On this day, I wish to again draw the attention of Nigerians to the National Health Insurance Authority law that makes it mandatory for everyone to subscribe to a health insurance package.
The representative of the World Health Organization, Miye Okamura, on our part, renewed partnership with the federal government on SDG Goal Target 2030.
Update national health plans and ensure public budgetary resources remain at the core of financing for universal health coverage. Strengthen health system by reorienting to primary health care, public and private capital, investments that are green, improve tax administration, reduce unnecessary, potentially harmful subsidies, supported by coordinated pooled partners funds as needed in supporting national plan. The recently enacted National Health Insurance Act and the Basic Healthcare Provision Fund are commendable examples of steps that Nigeria has taken towards ensuring reduced catastrophic out-of-pocket expenditure by the Nigerian people. Nigeria has shown commitment and taken commendable steps towards ensuring that every Nigerian across the vast country has access to quality health care whenever they need it without suffering financial hardship.
You must monitor your programs, you must evaluate them, you must go through the iteration of quality checks and improvement. That happens, and that is why, as you heard during the last NCH, extensive conversations happened around evaluating what has happened across the PHCs in the country. The administration is coming to an end. Elections are going to happen in February, handover is going to be in May. So stock is being taken of what efforts and achievements have happened. Some of those things speak to that effort. And just to say that, yes, there's been a lot of work done across PHCs, not by federal government alone, but there's a model center that is shared across states for them to be able to improve and build the sort of PHC.
The theme for this year's celebration is Build the World We Want, a healthy future for all. The government has called on all citizens to play their part in the goal to achieve a resilient health system that is able to provide quality services without impoverishing citizens.